the kidneys and stone formation, where we just felt your arm and you've got stone. You've got this right throughout the whole of the body, and it's from all these very serious sort of foods which have very, very high phosphate count, which is not for humans. Breast milk, 5 parts calcium, 2 parts phosphate. Leaf smut, 5 parts calcium, 2 parts phosphate.
Live food.
Dermot, it could be 20 to 2,000 times phosphate to 1 calcium. But we need to learn about what leaf smut is
Live food.
and dermot, and we need to value where we are with things, and we've got great insight, and people who are having a deep insight into things where there's a great care for the value of things to keep their enzymes. So people have become aware that heating food certainly is not right, and that is a great principle, but that's all. And then, as we've talked, changing your diet is a factor, but it would not heal most of these conditions up of itself. You absolutely have to learn how to do a non-surgical, non-druggist approach to dislodging the debris. So moving to leaf smut is
Live
not
food.
a true healing therapeutic, and all investigation shows it's not. Certainly other sorts of diets are, some could be moderately helpful to not at all, but ultimately food of itself would not change the condition, though you must learn about leaf smut and apply leaf smut
Live food.
and get rid of dermot, but you've got to actually do something which is non-surgical, more non-druggist, to dislodging the debris to cause the system to function again properly, right? If we've got a rusty, rotted system and blocked system, good food is not going to be processed properly. Does that make sense?
Yeah.
Yes. Good on you. Excellent. Okay. Behavioural deficiencies are always increased following high deficiencies, or deficit, that's okay, are always increased following more higher concentrations of dead food. So most people who do suffer from various conditions they know of, when they do dead food, the meditative state, which could have been present somewhat before that, can less than be remain nicely. Okay, isn't that a nice way to say it?
Happened to me.
So in the intestine, we have cannulas, and only frugivores on the earth have cannulas. Omnivores have no cannula, and carnivorous animals have no cannula, and herbivorous animals also have no cannulas, which is these ribs, right? These are called cannulas. So they are only found in the digestive tract in somatotyping, which is the science of, in physiology, how our environment has shaped our body. It's called somatotyping. There's microvilli, and these microvilli are like finger-like projections, which are in these cannulas. And then these finger-like projections have little gliaxal threads, which increase the surface area, and the cells that line these villi, right, they're called enterocytocin cells. Enterocytocin cells. And these cells which line these villi, which absorb water-soluble nutrient. Did you know that they don't exist on oxygen? They don't exist on sugar. They can't manage fat, no. They can't use any protein, no. Wow. Matter of fact, they can't use anything you eat. Wow, really? That's right. There is no respiration from these cells from anything you eat. Did you know that unless you have nerve cells in here, there is no glutamine, and that is the only substance that can nourish these absorptive cells. Have you heard this before?
No.
Well, this is very important. because without glutamine, without proper life colloid materials like what this material is in here,